2 weeks ago, on May 18th, we reached the threshold of getting 50% of eligible Albertans vaccinated with at least one dose and with fewer than 800 people in hospital with COVID-19. It's because of your collective efforts that we can safely begin easing public health measures today. The progress that we've made is remarkable. The time is clearly right to take this next step. Before I get into that, I'll provide today's daily numbers to show you just how far that we've come. Over the last 24 hours, we've identified 209 new cases of COVID-19 and completed about 4,100 tests. That means our positivity rate is 5.1%. And we have now 438 people in hospital being treated for COVID-19, 127 of whom are in the ICU. But let's look back just 1 week. Over the past 7 days, we've seen amazing progress. Our active cases declined by 44% between May 24th and May 31st. That's 5,300 fewer people who are sick with COVID today than a week ago. Our hospitalizations dropped by 133 patients over the same period. And same for the positivity rate. It went from just under 10% to just over 5% today. The R value, the rate by which we estimate the virus transmits, remains steady at 0.72%, which tells us that the steep decrease in cases continues. Now, let's turn the clock back and compare today's numbers to the peak of the third wave. At that peak, just over a month ago, we had over 25,000 active cases. That means active cases have declined by 73%. Actually, it was under a month ago. That was 3 weeks ago. So we've seen a 73% decline. The average number of new cases each week has fallen from nearly 2,000 to under 400, a drop of almost 80%. Think about the next time people say that vaccines don't work or that we're moving too fast. The people who are sickest and the pressures on our healthcare system continue to decline. Today, there are 438 people in hospital with COVID, a decrease of 40% from the peak on the 11th of May. The same is seen in intensive care, from a record 178 admissions on May 18th, down to 127 today. As these numbers continue to trend downward, we're beginning to see an easing of the pressure on our healthcare system. Now, don't get me wrong, we continue to have frontline staff, intensive care nurses and doctors and respiratory therapists and others who are doing tremendous frontline work and still, in many cases, under real pressure, and we deeply appreciate their work, but we're grateful to see the numbers moving in the right direction. The reason for this decline, which has been seen in many places around the world, is, in large part, vaccines, of course, in addition to the difficult measures that we brought in a month ago. Today, more than 2.81 million doses have been administered in our province. More than 63% of eligible Albertans are now protected with at least one dose. What's more, there have been only 433 so-called adverse events reported to date out of over 2.8 million vaccine doses administered. In other words, 99.98% of these vaccines have provided protection with no reported significant health concerns. And please remember that the next time somebody tells you that these vaccines are unproven or unsafe. An army of healthcare workers, health officials, pharmacy staff, and pharmacists are keeping our vaccination clinics humming smoothly, and I want to thank them for their dedicated work and effort. Throughout Alberta's rollout, they've quickly shifted gears to meet challenges of changing supply and demand, and they're working quickly and efficiently to get every Albertan protected. The Open for Summer plan is based on the expertise of health officials and the real-world evidence of the protective power of vaccines. Some have said that the plan is not properly considering variants or taking steps to improve screening for variants of concern, but that couldn't be further from the truth. Alberta's variant screening system has been one of the best in the country. Starting this week, we are once again screening all positive cases for variants. What's more, This includes screening every single case for the B1617 so-called Indian variant. But make no mistake, we can't stop new COVID variants from emerging. But we also cannot live in fear for the rest of the year, the rest of our lives. We know that vaccines work, even against these variants. We know they prevent severe outcomes like hospitalizations and death. And we know Albertans have worked incredibly hard to crush the spike and get vaccinated so we can have a great Alberta summer. Some have said that our plan does not consider second doses, which is also incorrect. Second doses are vital, which is why Alberta has led the country in administering them. Prior to the third wave in late March, only 2.8% of the eligible population was immunized with a second dose. As of today, more than 1 in 10 have received both first and second doses. And amongst those over the age of 75, coverage has increased from 7.5% at the end of March to 74% today. So amongst the most elderly, who are generally the most vulnerable to this disease, 3/4 have been fully vaccinated, a critical factor. And Alberta on that is a leader in Canada. At 10.4% of the eligible population fully vaccinated, Alberta leads all provinces and is almost double the national second dose average. Today, with supply increasing, we're taking this even further. And so today I'm announcing that every Albertan who has received their first dose of vaccine will be able to book their second dose appointment by the end of June. I know that millions of you have been waiting to hear this good news. From day one and throughout the pandemic, Alberta has had, I believe, one of the best vaccine rollouts in the country. The only thing that has held us back has been inconsistent supply. As you remember, earlier this spring, due to limited supply, we and other provinces had to change the interval between first and second doses to provide as many people as possible with the protection of at least one dose. Well, now that over 63% of people 12 and older have at least one dose, and there's a steady supply of vaccine coming to the province, we can begin administering second doses. This is yet another big milestone in our fight against COVID-19, and it takes us even closer to a post-pandemic world where we can get back to doing what we love and spending time with those that we most care about. Now, before you pick up the phone or log on to try and schedule an appointment, I'm sure some people have already done that. Bookings, please, this is an important note, bookings for second doses will be sequenced in the order that first doses were administered to ensure that everyone receives them at significantly less than the maximum 16-week interval. So Minister of Health Shandro will provide more details in a second, as well as what this means for people like myself who received the AstraZeneca vaccine. But if there are no unexpected delays to shipments, we expect most everyone awaiting their second dose should have it by the end of summer. Now, if you haven't yet booked your first dose, don't worry. You haven't lost your spot in the line. We'll continue to prioritize first doses for anybody who wants to be vaccinated. Though I encourage you to book your appointment now so you can confirm the time slot before things get too busy with these second dose bookings. We need Albertans to sign up, to show up, and to follow up for both their first and second doses. Here's how second dose booking will roll out. If you are one of the 239,000 Albertans who received your first dose anytime in the month of March or earlier, but you've not yet received a second dose, you can book that second dose appointment today. So just to make it real simple, if you got your first dose in March or earlier, you haven't yet had your second dose, you can go sign up right now. If you received your first dose in April, like myself, you can book your second dose starting in 2 weeks from now on June the 14th. So just to repeat again, if you got your first COVID-19 dose in the month of April, you can go online or register by phone or with your community pharmacy 2 weeks from now, June 14th. So please give the folks who are a little bit older than us the first kick at the can to get signed up. And if you got your first dose in May, these are the youngest Albertans, you'll be able to book your second dose starting in 4 weeks on June 28th. So March and earlier, today. They can go and get booked. April, people got dosed the first time in April. You can go on June 14, and the younger folks get to go and book their second dose appointments on June 28th. That means all Albertans with their first dose will be second dose eligible by the end of June. And this is fantastic. It's also a big part of why the Open for Summer plan, we are confident, will work. While being fully vaccinated wasn't defined as a public health trigger, it is a critical part to crushing COVID-19 in Alberta once and for all. It's embedded in our plan for population protection, as of course is natural immunity. On Friday, we reached the threshold of 60% of all Albertans over the age of 12 receiving at least one dose, starting the clock on our 2-week waiting period before those doses are fully effective. And that means that Alberta will enter stage 2 of the reopening on June the 10th. We've confirmed that. As long as hospitalizations stay below 500 and keep trending downwards as they are very clearly. The return to dining in restaurants with friends, gyms back open, larger outdoor gathering limits, and much more. We're close to all of that if we just need to keep following the rules and get those vaccines done. And after we reach stage 2, it will only be a matter of time before we reach the final stage of our Open for Summer plan. So the summer we have and the fall that we will prepare ourselves for is completely within our control. Every person, every single Albertan can make a difference, at least those who are 12 and above. Every dose delivered is another step closer to protecting your loved ones, your neighbors, and your community, and another step closer to getting our lives back to normal. If you haven't made an appointment, please do so. Please get protected. Life has been so closed off from others for so many of us for the past 15 months. It's time to open up Alberta, but the power is in your hands. And in the next few weeks, please continue carefully to follow the public health measures so we keep pushing those numbers down.